bacteria. But it's also about the way we're pushing into the last wild spaces on our planet. When we burn and plow the Amazon rainforest so that we can have cheap land for ranching, when the last of the African bush gets converted to farms, when wild animals in China are hunted to extinction, human beings come into contact with wildlife populations that they've never come into contact with before, and those populations have new kinds of diseases, bacteria, viruses, stuff we're not ready for. Bats, in particular, have a knack for hosting illnesses that can infect people, but they're not the only animals that do it. So as long as we keep making our remote places less remote, the outbreaks are going to keep coming. We can't stop the outbreaks with quarantine or travel restrictions. That's everybody's first impulse. Let's stop the people from moving. Let's stop this outbreak from happening. But the fact is, it's really hard to get a good quarantine in place. It's really hard to set up travel restrictions. Even the countries that have made serious investments in public health, like the US and South Korea, can't get that kind of restriction in place fast enough to actually stop an outbreak instantly. There's logistical reasons for that, and there's medical reasons. If you look at COVID-19, right now, it seems like it could have a period where you're infected and show no symptoms that's as long as 24 days. So people are walking around with this virus showing no signs. They're not going to get quarantined. Nobody knows they need quarantining. There's also some real costs to quarantine and to travel restrictions. Humans are social animals, and they resist when you try to hold them into place and when you try to separate them. We saw in the Ebola outbreak that as soon as you put a quarantine in place, people start trying to evade it. Individual patients, if they know there's a strict quarantine protocol, may not go for health care because they're afraid of the medical system or they can't afford care and they don't want to be separated from their family and friends. Politicians, government officials, when they know that they're going to get quarantined if they talk about outbreaks and cases, may conceal real information for fear of triggering a quarantine protocol. And of course, these kinds of evasions and dishonesty are exactly what it makes it so difficult to track a disease outbreak. We can get better at quarantines and travel restrictions, and we should, but they're not our only option, and they're not our best option for dealing with these situations. The real way for the long haul to make outbreaks less serious is to build the global health system, to support core healthcare functions in every country in the world, so that all countries, even poor ones, are able to rapidly identify and treat new infectious diseases as they emerge. China's taken a lot of criticism for its response to COVID-19. But the fact is, what if COVID-19 had emerged in Chad, which has 3.5 doctors for every 100,000 people? What if it had emerged in the Democratic Republic of Congo, which just released its last Ebola patient from treatment? The truth is, countries like this don't have the resources to respond to an infectious disease, not to treat people, and not to report on it fast enough to help the rest of the world. I led an evaluation of Ebola treatment centers in Sierra Leone. And the fact is, the local doctors in Sierra Leone identified the Ebola crisis very quickly. First as a dangerous, contagious hemorrhagic virus, and then as Ebola itself. But having identified it, they didn't have the resources to respond. They didn't have enough doctors, they didn't have enough hospital beds, and they didn't have enough information about how to treat Ebola or how to implement infection control. 11 doctors died in Sierra Leone of Ebola. The country only had 120 when the crisis started. By way of contrast, Dallas Baylor Medical Center has more than 1,000 physicians on staff. These are the kinds of inequities that kill people. First, they kill the poor people when the outbreaks start, and then they kill people all over the world when the outbreaks spread. If we really want to slow down these outbreaks and minimize their impact, we need to make sure that every country in the world has the capacity to identify new diseases, treat them, and report about them so they can share information.